Were you aware that heart disease is responsible for the deaths of about 650,000 people in the United States every year? That accounts for one death out of every 4. Remarkably, a significant number of individuals do not become aware that their heart is in danger until it is already too late. On the other hand, your body may be sending you subtle indications, such as inexplicable weariness, panic attacks, or even mood fluctuations. In today's video, we will reveal 5 unexpected indicators of concealed heart problems that you just cannot afford to ignore. These signs require immediate attention. Number 1. Migraines. Despite the fact that the majority of headaches are not cause for concern, did you know that migraines that are severe and frequent, particularly those that are accompanied by an aura, might be an indication of underlying cardiac problems? Oftentimes, visual abnormalities such as flashing lights, blind patches, or even momentary vision loss are associated with an aura, which functions similarly to a warning signal before the headache really occurs. There appears to be a correlation between these migraines and cardiac problems, according to research. You can have the impression that your brain is attempting to convey to you some essential information regarding your cardiovascular system. In the event that you suffer from migraines with aura on a frequent basis, it is imperative that you seek medical attention. Whether or not there is a connection to your heart health, they are able to evaluate it and make recommendations on the steps that should be taken to protect both your mind and your heart. It is important to keep in mind that your migraines may be more than simply a headache. They may be an important indicator that may help you better understand your overall health. Consequently, do not be afraid to seek the advice of professionals and make your health the highest priority. Number 2. Panic attacks. There are times when we all feel anxious or stressed out, but have you ever considered the possibility that the rapid heartbeats and sweaty palms you are experiencing might be more than simply a panic attack? The idea that these powerful bouts might possibly be early warning symptoms of a heart attack is a terrifying one to consider. It is very uncommon for people to have feelings of anxiety, sweating, or nausea during a panic attack. Nevertheless, it is of the utmost need to seek immediate medical assistance if these symptoms are accompanied with chest tightness, heaviness in the chest pain, or anxiety. There is a possibility that these sensations are indicative of a major cardiac disease that demands immediate medical attention. Hence, you should not wait or attempt to tough it out. It is important to keep in mind that when it comes to your heart, it is always best to be careful. Sudden heart attacks are possible, and every minute counts in the event of emergency. The speed with which you arrive at the emergency department can have a substantial influence on the likelihood of your recovery. If you or someone you are with is experiencing these symptoms, you should not wait. You should contact for assistance as soon as possible. Your prompt response can be the deciding factor in whether or not someone lives or dies. Number 3. Pain while walking. It's possible that you believe that achy legs after a long walk are simply a sign of getting older, but what if it's something else entirely? It is possible that you have peripheral artery disease, PAD, if you have cramping or discomfort in the muscles of your hips or legs that goes away when you relax. This might be a warning sign for the condition by itself. Fatty plaque can cause peripheral arterial disease, PAD, by obstructing the arteries in your legs, which makes it more difficult for blood to flow freely. Because of this limited blood flow, pain and discomfort might be triggered, particularly when engaging in physical activity. Imagine it as a bottleneck in your arteries in the form of traffic. PAD is not simply a condition that causes discomfort in the legs. It is also a significant indicator that your heart may be in jeopardy as well. Individuals who suffer from PAD are at a greatly increased risk of getting cardiovascular disease. Therefore, if you are experiencing these symptoms, you should not dismiss them as the result of mere aging. Talking to your physician is really necessary. If PAD is the cause of your symptoms, they will be able to identify it and assist you in managing it, therefore preserving both your legs and your heart. Keep in mind that early diagnosis is essential to maintaining the health and strength of your heart. Number 4. Fatigue. Isn't it true that feeling fatigued is a natural part of life? There will be times when we all find ourselves dragging our feet. What if, however, that tiredness gives you a different sensation, one that is more profound, like a bone-deep weariness that refuses to go away? This is not the typical exhaustion that one might experience after a late night or a busy week. Specifically, we are referring to the type of exhaustion that makes you feel as though you have been battling the illness for days on end, even though you haven't actually been sick. It is difficult for your heart to pump blood to the tissues of your body when it is not functioning as efficiently as it should. As your body works to reroute blood flow to vital organs like your heart and brain, you may experience feelings of exhaustion as a result of this. In spite of the fact that there are a great number of possible reasons for fatigue, it is important to consult with your physician if you routinely have feelings of exhaustion. To identify whether this excessive exhaustion is an indication of underlying heart troubles or another health condition, they are able to provide assistance. Number 5. Depressive feelings. The sense of being down in the dumps might be more than just a terrible day. It is not only about the physical symptoms. It might be telling you something about the state of your heart. Research has demonstrated that there is a substantial connection between mental and physical well-being. Even while experiencing depression does not necessarily inherently indicate that you have cardiac issues. Depression may be associated with an increased chance of having cardiac problems, according to studies that have been conducted. Heart illness and depression can both make each other's symptoms worse. This is a two-way street. It is essential to place a high priority on both your mental health and your heart health if you're experiencing chronic feelings of depression or frustration. There are instances when the emotional toll of sorrow or stress can appear in physical ways, which may have an effect on your heart. Because of this, it is really vital to talk to someone if you're having difficulty. In addition to taking care of your heart, you need also take care of your mental health. Keep in mind that reaching out to a mental health professional or a physician is a start in the right direction toward feeling better in general. Do not be afraid to ask for assistance. Your heart will be grateful to you. Conclusion. If you have had any of these symptoms, you should not be reluctant to make an appointment with your physician. With their assistance, you will be able to maintain control of your heart health and receive the necessary direction and support. One thing to keep in mind is that early intervention may make all the difference. We appreciate you watching. For further health advice and insights, don't forget to like and subscribe to this Natural Life Hacks channel. Take care of yourselves, and don't forget that the health of your heart is something that ought to be fought for.